Okay, I'm here to brag about my partner in life and partner in business, Dr. Gordon Elder. And apparently my face shows how proud I am of him. And that comes from the fact that I see that he's the real deal. So he's a doctor of chiropractic. And that is about similar amount of work as a medical doctor. A lot of people don't know that the education is as much as medical doctor. It's just at some point when medicine branches off to learn about drugs and surgery, chiropractors learn about joints and manipulation and precision adjustments. And then in addition to that, all chiropractors have to have a certain amount of continuing education every year. That's every chiropractor. In addition, but here's the deal. A few people go over and beyond and put in the extra work that other people are not willing to do, and that's my husband. And the reason I'm talking about it is he just does it, and he cares, and he gets shy talking about himself, but okay, I need a break. Is that going to mess it up?
No, we can take a
okay. Okay. So let me just go over his qualifications and the things that I think set him apart. So even before he was in chiropractic college, but had decided to go there, he sought out mentoring by one of the top experts in upper cervical chiropractic, which is Dr. Arvold and Muncie. That's another story. All through chiropractic school, if he had a day off, he would go to his clinic and shadow him. When there was time, he would practice his adjustments and get critiqued, so he would be right on. He would never learn any bad habits. As soon as he was out of chiropractic college, he got an extra certification in taking care of kids, all ages from infants and up to adulthood. There's certifications within Blair, and in order to call yourself a Blair chiropractor, you have to have taken some classes. Some people go over and beyond and get certified in the Blair technique. There's a whole process, and there's 3 levels of certification, and Gordon has gone through all of those. And in addition to that, anytime there's been a problem patient, or someone's not responding, or he has a question, I have seen he's closed down the office, traveled to an expert, done whatever it takes to figure it out and get better. Part of that was coming to Lubbock, Texas. When he came here, he made a really good friend, the previous director of the Blair Clinic, Dr. Art Addington. He went over and beyond as a friend, spent hours and countless hours and hours and hours just talking about technical details that you and I would not understand, even though it is English. As a friend of Dr. Addington, while we were still in California, he shut down the clinic in California for a week. That means no income. Flew to Texas at his own expense and took his friend Dr. Addington in a van to get some medical care in Davenport, Iowa, and drove him back and flew back. Now, that is a friend that goes over and beyond. As his wife, I see the stuff that nobody else sees. The certifications are not just papers on the wall. There's hours and hours and hours of work that transfers into quality care for our patients, and that's why it's important. What he's doing these days that goes over and beyond, not only is he satisfied with all the most advanced certifications within Blair, but there's an extra level of specialization called DCCJP. What that is Diplomate in Cranial Cervical Junction. What that means, it's the part of the body where the head and neck come together. And it's a 3-year program, and only people who have completed that can call themselves specialists. He was due to graduate this month, but because of COVID, it will be in a few months because some of the classes were postponed. And as part of that, he's done some research working on publishing research, and in a minute he'll tell us why that's important. And again, it's hours and countless hours of really tedious, boring work that most chiropractors are not able or willing to put in that kind of work. And as if all of this is not enough, running the clinic, teaching classes to teach other chiropractors how to be doctors, also writing a chapter in a textbook. It's the Blair Upper Cervical textbook. I don't know what it's called, right? But anyway, he's writing the chapter on how to make the adjustments. Really important chapter if you're a patient, that the doctor who reads that book knows how to do that right. So also in addition to that, I do see how he thinks about his patient, treats his patients, but also talk about them when they're not there, rejoices when progress is happening. If progress is slower or there's a bump along the way, how he worries, kind of like he does with our kids. So also he's an awesome son to his mom, great husband and life partner, and a good daddy to our kids.